First tonight, some optimism from Leicester's health boss. He's told us he's hopeful the coronavirus lockdown can be lifted on August the 1st. But Director of Public Health, Ivan Brown, says it's crucial that people all over the city take part in testing programmes. Our social affairs correspondent, Jeremy Ball, reports.
Street to street, door to door, in English and in Gujarati. They're among hundreds of volunteers visiting homes in parts of Leicester where they're now trying to persuade everyone to take a simple test. Donna's already done it herself.
I had a sore throat and a bit of a temperature, so I thought best to get tested just in case, and peace of mind for myself and the family. And within 3 days I got the results back and they were negative, so which was a relief.
The city's done around 90,000 COVID tests in the last few weeks, around one for every 4 people who live in Leicester. The Director of Public Health says he's hopeful that it'll help end Leicester's lockdown on August the 1st and to open local schools at the start of the autumn term.
We need to keep going, and I understand that people are frustrated by that fact, but we're doing well and we are turning this around. I mean, I liken this to turning the tanker. It's moving in the right direction, but we've still got a way to go. So we're asking people to be tested to make sure that they're in a position where they can protect their families and their loved ones by knowing what their status is and taking the appropriate action.
They think extra testing, like this pop-up centre on a park at Rushy Mead, is finding the virus more quickly, and by looking harder, they're catching cases that wouldn't be discovered elsewhere. That's helping keep hospital admissions for COVID in Leicester to around the national average. The COVID test only takes a couple of minutes. You use this swab to check your throat and your nose, then you simply pop it in a vial and seal it in a bag. These tests have already identified hot spots in the east and the north of the city, but Ivan Brown says everyone in Leicester needs to take this seriously.
The virus doesn't discriminate. It's not just factories, it's not just particular communities, it's not just particular workplaces. It can go across the piece, and that's why we have to tackle it holistically. So it might be in a particular area of the city today. It doesn't preclude it from being somewhere else tomorrow. So we've got to have that kind of approach where we take it as a whole.
And back in North Evington, the volunteers are collecting those home testing kits. For many here, that's reassuring.
If you know whether you're infected or then you know you're better prepared. The rest of the family is protected, so it's a good idea.
We just pray to God. Yeah, everything will be all right.
Leicester saw far fewer coronavirus cases last week, and today it emerged that this city's infection rates are no longer the worst in the country. But this battle against an invisible enemy is far from over. Jeremy Ball, BBC's Midlands Today, Leicester.